All right, so let's run through logistics for the course. This is probably one of the most easygoing modules as far as content and the speed we cover things. To get to where we are now, we've come through an orthopedic pathway. So what you've got to understand is the majority of dentists / orthodontists who do straight wire only do straight wire. So their definition of orthodontics is permanent dentition, brackets on, blah, blah, blah. That's where we're at today. But I just want you to appreciate that even though today, tomorrow, the next day's lecture is all about moving teeth, we've got here the proper way, which is doing dentofacial orthopedics, all right? So what I'll be covering in the module, this is course 6, is how you can wean off a lot of your orthopedic appliance into orthodontics. That's where you guys are. How in a non-growing individual you can enhance the orthopedic effect of your orthodontics, right? Which is the disarticulation, early use of light elastics, etc., right? And most of the things I want to go through relates to case finishing. Now, I'm not going to cover the case finishing from a where the brackets go on point of view, because we've done that already. I'm going to cover it more, well, you know, something's gone wrong during treatment, either failure to wear elastics or wrong bracket prescription or incorrect position of the bracket or numerous breakages, you know, things that realistically happen, and how do we get ourselves out of trouble. And in that regard, I want to go through first, second, third order bends in detail, because if your ability to use a second order plier or a third order plier will really help your case finishes improve and make it easier for you when you have those cases that just aren't quite working out the way you want them to be. The other thing that I will cover is the dilemma a lot of you have in selection of molar prescription, right? Because molar prescription is as important in selection as your anterior brackets. Everyone focuses on the anteriors, but you're doing a lot of Damon, you may be doing a lot of orthopedics prior to Damon, so the torque values you'll be using will be different. And the torque value you use in a open bite vertical grower will be different to a deep bite because of what happens to the lower molar. So that's another big sort of component. And then I guess, analogous with straight wire comes two considerations: anchorage control, which in the past has been removables like headgear, etc. Nowadays it's very much microimplants or TAD, so we'll cover that component. And the second is space creation, right? So for you guys who are doing Damon, the space creation dilemma decision is not as difficult because space creation actually occurs through your arch wires, right? So, you know, if I'm 25 years ago sitting in Gray's Inn Road planning cases, it would all be on millimeters of crowding and it would all be on anchorage. That's all we did, yep. Now, I don't give two hoots about crowding, I look at the face. Anchorage is important, but not as important in a light wire technique, because the heavier wires tend to burn anchorage a lot quicker, and we'll cover those sort of terms, right? The section that I think you'll find really useful in what we're covering as far as passive self-ligation is, believe it or not, the ortho-organiser section, not too much the Damon component. Shorts Corkhouse, just one thing I want to say on that, a lot of the cases you're going to see over the next few days, the first decision I'm making is not on millimeters of crowding. People get confused. When I say 6 millimeters, whether it's going to be an orthopedic appliance applied to straight wire, I'm not talking about millimeters of crowding. That's where you guys are getting a lot of confusion. Millimeters of crowding used to be the old mesiodistal width of every damn tooth, then the arch form, and you do the difference between the two, and if it was 5 millimeters or greater, you'd extract premolars. That's the old deal, yeah? Now, I don't do that measurement, yeah? So, other than Bolton's discrepancy, I'm not really concerned about millimeters of dental crowding. Why? Because I can resolve 16 millimeters of crowding non-extraction using the mechanics we have. Does that kind of make sense? I'm talking about arch width, yeah? So, if the bicuspid, dimension is narrower than 6 mils, you're not going to get there with Damon and the 014 wire. That's what I'm getting at. So that's why I still want a Shorts Corecast, just so I can lead you along the lines of bonded Hyrax, banded Hyrax, ALF, prior to straight wire. All right. In regard to mechanics, I will cover traditional twin mechanics, but really it's arbitrary because that's like me covering headgear. Yeah. Passive self-ligation, whether you use Carrier or Damon or Tenbrook or Lotus or all the other millions of designs that have copied Damon, the result's the same. So I want to talk a lot about the wire technology and why we're using the wires we're using. I want to explain to you about why TMA/beta titanium is a far better finishing wire when you're doing these bends, etc. As far as recommended reading, a great book to mimic what you're actually doing is this textbook, and it explains the philosophy of doing non-extraction by doing orthopedics before straight wire, right? This doctor was trained, his name's Raphael Greenfield, right? Raphael's retired now. I've known him for like 20 years. He trained under Norm Setlin, right? And if you understand when I've talked to you about stability, the best stable cases have always been Norm Setlin's. And Setlin started his treatment using a lip bumper so that the teeth ended up kind of drifting into a right spot before he put straight wire on, right? So what Raphael Greenfield teaches in his courses, and remember, you're going to do the mini residency, and that's just going to be a lead-in for you to listen to other people, but you don't want to be confused and then listen to someone who's got totally conflicting philosophy, etc. So the Bill Clarks of the world are fantastic. Raphael Greenfield's fantastic. Why? They're pushing this whole facial balance rather than just aligning teeth. So what he's talking about, he looks at crowding, not in millimeters, but he looks at it in arch form, right? And the point he's saying there, he looks at the buccal segment. And then the lower buccal segment leans in, he knows this is going to be a non-extraction case, right? Whereas if the lower buccal segment is upright and there's a lot of crowding, he's looking more along the lines of extraction, yeah? But using that philosophy rather than the 5 millimeters of crowding philosophy, his textbook's got a good heading, and it's called 98.5% non-extraction in his practice. And he's been in practice 40 years. His first year out, his extraction rate was the opposite, 98.5% bicuspid. So it's a really good pilgrimage. And what's good about this book, you can use it at consults because he documents every case. And he's got like hundreds of cases there. So that's the book I'd recommend if you want to do orthopedics twin bracket, right? As far as mechanics, anchorage, the Bible is still Bennett's book. It's now called MBT. When I did the training, it was just Bennett and McLaughlin. He was the US guy from San Diego. He's from London, UK. He was one of my instructors at the Eastman. Probably learnt more from him than anyone else there. Why? He was talking about the concept of using pre-adjusted edgewise, whereas what we were taught at the Eastman was standard edgewise. So one thing good about standard edgewise, it makes you a good wire bender. One thing bad about standard edgewise, your case finishing is very poor, right? So you guys have really the best of both worlds. So I'm using his book as a good method of doing the 3 days of lectures because it covers anchorage, leveling and aligning phase, which to us is the 014 wire. Then it goes through overbite overjet control, which for us is the 1425, 1825 with elastics. Then space closure, which for us is NiTi coil springs in bicuspid cases, right? But is tie-back modules in non-extraction cases. With Damon, with orthopedics, you're always going to have residual space. Your ability to control that space is the skill level. So I want you to reassess the face at your Pano appointment, yep. And I want you to then set things up for efficient space closure, which is normally type C anchorage. Type C anchorage means the back teeth come forward. 98.5% of your cases, you close spacing from behind the arch. Traditional orthodontics, right, the way they're teaching is type A anchorage, where you lock up your molars and you drag everything back, right? But you will need to know that in your extraction cases, which are your bidental protrusion. So to me, I will do a whole lecture on space closure extraction cases, yep. What's the difference? Traditional method of doing extraction used to be based on crowding. So the deal was you would actually extract 4 premolars before you strap the case up. By the time you were ready to slide, close space, it was normally 9 to 12 months because that's how long it took you to level and align. And the problem then arises that you've got an extraction socket that's healed. So space closure becomes difficult, right? With Damon, we tend to extract in cases that are not crowded, right? You know that. It's cases that are full. And those are they're the cases that don't have crowding, actually have spacing. So we tend to take our bicuspids in Damon when we're ready to slide. So in the extraction lecture, I'll be talking about 2 types of individual. I'm just trying to get your head around this, right? The most common individual is the bidental protrusion patient, division 3. They don't have crowding. You can start their case in a 1425, yep? You can then whack straight into a 1925 TMA, 1725 TMA, and you're done, right? When you whack in the 1725 TMA, then you take out your lower buys. Why? Because the day you extract is the day you slide, right? So I'll go through that type of individual. The other individual is very rare, but does exist, and that's the bidental protrusive patient with a ton of crowding. Now that's the case you still extract before you strap up. Why? Because with Damon, the round wire, 014, that's doing your leveling and aligning will also, with good lip seal, close most of your extraction space. Yeah? So I'm going to teach you how, in an extraction case that's crowded and protrusive, it's really important to have lip seal. Because if you don't have lip seal, taking out those premolar teeth early is going to be round tripping. Now that might be a bit hard for you to get around your head, but when you see the cases, you'll understand. But most of your cases, if you follow the Damon philosophy of the profile, are full. That's why they need extraction, but they're not crowded. Yeah, it's the rare beast that's full and crowded, and we'll go through those mechanisms. But most of your space closure, and you're getting to the stage now where you're putting in your finishing wires, most of your space closure is going to be with tie-back modules. And I really want to cover that so you understand how you can not stuff up your arch form. I still see cases today from guys that I've taught that, you know, they do all the right thing and then they bloody go power chain 7 to 7 to finish their case. And they've just stuffed their entire Damon arch form. Not to mention detorquing their upper anteriors. So we want to teach you ways to consolidate your upper anteriors, torque them, then burn the anchorage type C. These are the sort of things that you'll get to the stage at the end of this course where it'll be frustrating as hell for you to talk to a novice in orthodontics. Who would agree? And that could be a specialist or general dentist, you know, and I'm not saying that, you know, to be pig-headed, but it's just when you're dealing with some idiot who doesn't understand Damon, who has no clue on facial thing and thinks he knows what he's doing, you just you know, don't want to sort of be there. In the same way, you guys will get the system so well, your diagnosis will be so accurate. Where you're struggling now is not so much your diagnosis, but getting your diagnosis into fruition, into your case finishing, and that's where the straight wire module is sort of good. Now, the second book by Bennett McLaughlin, they changed the chapter headings into teeth, right? So they talk all about incisors, torque prescription, then canines. How in an extraction case, when you bring your canine back, it tends to do this. So the roots lock into the cortical plate, which is going to make it harder to close your extraction space. You know, They talk about canines in Div 2s, where the lower canine needs to upright, that sort of thing. So I'm also going to cover lectures on teeth, where I go through the things you need to know about prescriptions, in particular, first molar, okay? As you know, with our second molars, particularly in our vertical growers, we want to try not to involve them too much. In all our cases, our upper second molar, remember, we intrude to get that plunging cusp out of the way in case finishing. Third molar, I will touch on second molar replacement therapy, when we do it, why we do it, and how we upright the third if it comes through at a bad angle. So their second textbook talked about chapter headings on teeth. Now, their last textbook, which is the one that's currently available and they've thrown in the Brazilian, that's the one to get. Why? Because it basically covers not as in-depth, but still the salient points, what book 1 and 2 did. It covers the overbite, overjet, anchorage, etc. So the Bible in orthodontics in the Wikipedia is Prophet. Yeah. The Bible in straight wire is this one. Remember that there is no Damon textbook per se. There's lots of clinical teaching manuals, right? Between you, me, and the gatepost, most of the Damon operators tend to be like me, wet-fingered clinicians who actually have to get up and work for a living, as opposed to sit in an ivory tower and write research papers. So get the clinical info out of Damon. Get a lot of the mechanics like lace backs. So we'll be talking to you how, if you have a center line here, how you're going to whack it over there, not just with your stop on your arch wire, but also with your mechanics, right? How you're going to boost anchorage on this side and push, boost anchorage on this side and pull, right? And as you do that, how you're going to stop your incisors flaring forward. That's covered really well in this MBT book. But MBT is very twin based. It's all on a Siamese 4-tie bracket O-ring deal. For people who are doing PSL, this little book summarises the difference between PSL and twin in the theoretical concept. So when I talk about elastics, it's all there. When I talk about your arch form, it's all there. So that's the sort of good little summary book. The better book, if you want clinical information in Damon, is this book. And there was a bit of time where Andy Price was such a nice guy that he bought this book and gave it out to everyone. That was about 10 years ago, I think, right? Is that right? Yeah. Now he doesn't. But it's a good book. The reason it's a good book is, and remember, the drama was he got it at such a good price because he got the bloody Korean version, right? And we had to return them all and get the English version. So when you buy this, it's written by Korean Damon guys, yeah? Need to say Dr. Kim squared or something like that, yeah? Am I right? Yeah. So you need to get the English version of this, and what's good about this, it's got great step-by-step photos. So if you're struggling a bit on how do you put these tie-back modules on and how do I do my anterior anchorage while I do the tie-back module, this is the book, because it's like the idiot's guide to Damon. Yeah, it's got a photo of everything there. So that's what I'd recommend from a Damon perspective. Yeah, so that's a purchasable textbook. So of course is the MBT. Yeah, this is a freebie. You get this through the Ormco Clinical website. What's good about this, it allows you to put your theory into clinical practice. For instance, case 1 is a Bimax case treated non-extraction, a therapeutic diagnosis. A really good case as far as you would be concerned is a class 2 that has TMJ problems. It's a Div 2 deep bite and it goes through the mechanics. Those people who want to do crossbite using the Damon sequence rather than orthopedics, it's covered there. Now, When you get more advanced, and certainly when we start doing biomechanics, then we talk about the Nanda type books. For a beginner, that's an overkill because they won't understand diddly squat. Talks about alpha beta moments, talks about how if you are going to bring a canine down using a cantilever, where you'd put your loop to minimize your forces on the canine, that sort of deal. And that's what I'll cover in the biomechanics lecture. Nanda's another really good guy to listen to, but only once you're really doing a lot of cases and you want to get yourself out of trouble in some of your deep bites. What I'm going to teach you from his component in day 3 of this course is how you deal with a open bite that has a steep mandibular plane angle as opposed to a deep bite that has a steep mandibular plane angle, so that you can understand the biomechanics vary. There's 4 biomechanic principles taught by him, and that is based on the dental at the front, the wedge at the back. And as a result, you can have a deep bite at the front and a vertical grower, or a deep bite at the front and a low angle. Yep. Or you can have an open bite and a vertical grower caused by the skeletal open bite, or a brachyfacial open bite caused by thumb sucking. But all the mechanics are going to be different. The only thing I would warn is do not get his original book, because there was no emphasis on facial aesthetics. Just like the first 6 versions of Prophet, I wouldn't get. I'd get the Prophet Sava edition. His book, if you're going to get into biomechanics, is this one, Biomechanics and Aesthetic Strategies. That's a lot about the smile arc, a lot about treating cants, that'd be the book on biomechanics. So if you get the opportunity again, Ravi runs a 1-week biomechanics course in University of Connecticut. Yeah. He's the chairman of orthodontics there. The previous chairman was Charlie Burstone, another sort of legend in the field of biomechanics. It's worth doing. So I'm giving you some tips. When you finish your 3 years with me, first thing you want to go do is enroll in Excellence in Orthodontics, Nigel Harradine, David Burney. Why? English specialists. You'll realise, geez, everything Derek's taught is not that far out. It's pretty much what the guys who have a brain in the UK are doing at a specialist level. Right, so that's one course you'll do. Then I would suggest you go and do some mini residencies. Mini residencies in TADS, in Korea, mini residencies in biomechanics. I can recommend the thing, but University of Connecticut, mini residency biomechanics, you're really going to come back and finish your cases like you wouldn't believe. Okay, so let's get the ball rolling. What I'm trying to cover the next 3 days is some theory and then applying that to clinical case. I'm going to apply the theory to the clinical case in traditional mechanics and then compare and contrast into self-ligating, right? Even in self-ligating, as you well know, Damon, original workbook, no elastics, no disarticulation, standard prescription, 1925 stainless steel, then the elastic started. Yep, old hat. If you look at your Damon manual, your original one, you'll realise that within a year he got to 1925 stainless steel, and his cases looked very ordinary. And then on the D-band, the cases looked magnificent. And it took me a long time to work out what was going on. Damon spent 12 months doing first, second, third order bends on his 1925 stainless steel. Do you understand, right? And during that 9 months of case finishing, he was putting 6 ounce, 5/16 heavy elastics to do his vertical, to do his AP, right? So, yep, it worked, and there's no doubt those cases are fantastic, but you're talking 2.5 years of therapy, which you can combine into 14, 18 months. Why? Because you're doing your vertical and your AP now with your elastics. You're not needing to do as many first, second, third order bends because of your variable torque prescription. And that's where I think Insignia will come into its own for you guys as GPs, because a lot of the torque decisions are going to be made for you, even though you will still need to interact with the team as far as bracket position, etc. is concerned, right? So every case now that we're going to present, whether it's a class 3 open bite or a class 2 deep bite, you need to go through those 6 points. Yeah? So I think a great way to start the 3 days is for us to just put up a difficult case, but break it down into simple components, and see how that travels with you as far as your sequence, right? So variable talk. Now, I've got a whole lecture on variable talk. Bottom line is, what you need to do is just memorize your current prescription. Whatever it is you're using, just memorize it. So you should be able to, reiterate for me what your options are for your lower canines and whatever the hell you're using at the moment. Yep. Now, if that's delta force, then you need to know what your canine is for delta force, so I can then tell you whether you might need to vary that, etc. Early elastics. Early elastics are used in 90% of cases. When are they not used? Class 1 neutral vertical, which is, in my practice, never seen. That would be your Invisalign case. Class 2 deep bite, you're going to use long elastics. Class 2 open bite, you're going to use short elastics. You will have a centerline discrepancy in some of these cases. So you might need to introduce what's called cross elastics for the centerline, or midline elastics. You might have, so the case from hell, class 3 open bite with a centerline shift because of a unilateral impacted canine, yeah? With a cross bite on one side. Does that make sense? And all you have in your toolbox is Damon, no orthopedic appliances. Well, a good Damon operator will get that deal straight away, but they'll disarticulate at the back of the wedge. They'll be starting light class 3 from day 1, anterior trapezoidal at night, and to supplement their light class 3, they'll be doing a cross elastic on the side of the crossbite. On the side of the crossbite, because they're using cross elastics and the Damon guy knows his molar is going to tip, he's going to have a totally different prescription for that tooth. See the planning? Yep. That same Damon operator knows that the last 100 class 3 open bites he didn't show a lot of upper incisors because they tend not to. And as a result, he put his brackets more gingival for smile display. That Damon operator would know that open bites close by detorquing incisors. So whatever bracket prescription he's chosen, so there's a number of steps, right, that's going to get that guy without any orthopedics, without any lab holding his hand, to finish that case kick-ass, right? And that's where I want you to be at the end of the 3 years. And it'll just be by osmosis, but the more you think, the more it'll make sort of sense. So, when don't I use elastics? In the class 1 neutral vertical. Now, when I taught Damon, this is the first lectures 10 years ago, we would teach upper arch only. Don't strap the lower, remember? And we'd go up to a 1425 in the upper, then use that upper 014 in the lower. Why? Because we never use elastics in that state. Now, in all my cases, I'm disarticulating and using elastics if they're class 2, class 3, open bite, deep bite, right? Where I disarticulate is a skill, and I've got a whole lecture on that. So, class 3 pseudo bite, I'm disarticulating on the lower incisors, right? Any open bite that's skeletal, I'm disarticulating on the molars. In a cross elastic situation, the best place to disarticulate is going to be in the premolar, because if you do it anywhere else, it's going to be very unstable for the jaw joint. If you go anteriorly, you can't kick the crossbite if you do it on the molar because it's preventing that contact from occurring, etc., etc. So I think a good way for you to get these notes is to have your Damon protocol manual open and score little notes on there so you can sort of put it together.